That was a weak clap. Anyway, what's up? It's BD. Today I'm going to be talking about the P shot, otherwise known as PRP injections for penis enlargement. Before I get into it, if you like what I do, subscribe. If you like this video in particular, like it. Let's just get into it. So, the P shot, also known as the Priapus shot for the Greek god of fertility, is one of the few penis enhancement procedures that I can actually recommend. First off, it's not invasive, so they won't be cutting open your phallus to be adding a prosthetic or cutting the suspensory ligament, somewhat damaging the functionality of your penis. Unlike fillers like hyaluronic acid and PMMA and silicone, PRP equates to real tissue over time. The only issue is it's not instantaneous. But if you're patient, you'll have much better results, in my opinion, compared to hyaluronic acid, etc. Virtually, there is no downtime with PRP. Once you come out of the procedure, wait a few hours. If you're not sore, you can go ahead and use your penis for whatever you see fit. They're stackable, so you can go in and get as many injections as you want. Obviously, there might be a diminishing rate of return, but I've seen as many as 6 taken at one time for increased gains. So what is PRP? PRP is platelet-rich plasma. Our blood is made up of 2 main parts, the red blood cells and then the plasma. The plasma is a water-based liquid that carries the white blood cells and other nutrients along with what we call platelets. These platelets are what your body uses to close wounds. They're basically stubs of stem cells. They're very sticky, and inside them they're filled with growth factors such as vaso-endothelial growth factor, platelet-derived growth factor, and I'm not sure if IGF's in them, but again, for our intensive purposes, the main 2 that we need to worry about are platelet-derived growth factor and vaso-endothelial growth factor, as they spawn new tissue, specifically for blood holding. First, what is PRP? PRP stands for platelet-rich plasma. Your blood is made up of 2 main parts, the plasma, which is like a liquid that carries non-red blood cells. So that would be your blood platelets, white blood cells, and other nutrients in your bloodstream. And then you have your red blood cells, which does, most of the oxygenation work in your tissues. Now, we can separate this pretty easily, and that's how we do blood transfusions. We can break down the blood plasma even more into platelet-rich plasma and platelet-poor plasma. Platelet-rich plasma is essentially a concentrated dose of platelets, stubs of stem cells, essentially. And inside these stem cells, there are a bunch of growth factors, specifically vaso-endothelial growth factor and platelet-derived growth factor. These are what signals your body to heal. So essentially, platelets do 2 things. They clump together, stopping bleeding, and then they signal more growth factors in these cells that they came in contact with to grow and to divide, to cover up the wound. And then an important thing to note, the younger you are, the more platelets you have. So if you're my age, 25, you're going to have much more blood platelets than, say, someone who's 55. But I'll get more into that in a bit. So let's talk about the procedure. Blood is drawn from the arm, and normally they take anywhere between 60 and 120 millimeters. 120 millimeters is a lot of blood to give for this, but it's not unheard of. And then based on the amount of blood they draw, the more PRP they can get. The only problem is that if the bigger the injection volume, the more likely you are to bruise, which isn't that big of a deal, but it can be unsightly and uncomfortable for the first week or 2. To separate the blood from the platelets, we need to literally spin them really fast in a centrifuge. This process takes about 10 minutes. Since red blood cells are heavier than the plasma, they sink to the bottom while the platelets rise to the top, along with the platelet poor plasma. Then what you do is you wait for the plasma to settle. The PRP drops to the bottom, so it's kind of like a salad dressing. So you have the dense oils at the bottom and then the floaty bits at the top and the water above that. So what we want is the little floaty bits of the PRP, which would be in the center. The doctor will draw that out from the sample, separating the PRP from the PPP. And the waiting time for them to separate is about 10 to 20 minutes. So once the doctor separates the PRP from the platelet poor plasma, he will add a activation agent. This is usually calcium carbonate. The doctor will take out the PRP. The PRP is then evenly distributed between multiple syringes. So that way you can get even doses all the way up the corpus cavernosum and the corpus spongiosum. Those are the two main chambers of the penis. Typically the yield for PRP is anywhere from 15 milliliters to 30 milliliters, depending on your age, how much blood they've taken, and etc. Based on your own starting size before the procedure, your doctor's only going to be able to inject so much PRP into your penis. It doesn't really change the results if we're talking percentage-wise, but I know it might be disappointing to hear that you can get the full 30 milliliters. And that's fine, trust me. Based on what I've read and from the people I know who have done this, it doesn't really matter the injection volume, as long as it's adequate. And as I brought up beforehand, age determines on how many blood platelets you have. However, you can circumvent this by using placental stem cells. So this would be from a donor. Doctors have access to this stuff. So your clinic might actually have stem cells on hand for you. So if you're above 40, you probably want to go this route if you want to have similar results, if not better, compared to a younger man. But I understand it can be kind of weird to be injecting someone else's cells into you. But if that's not an issue for you, by all means, go for it. So this is the most important part coming up. We need to activate the PRP. That literally means we are going to burst them open using a high salinity solution. Normally this solution is calcium chloride, just because it has a much faster release. Now we do this to release all the growth factors inside the platelets. This will then signal your body to release many more platelets over the course of the next 3 months into your penis, causing it to grow more than it would if we use non-activated PRPs or non-burst. So for best results, you want to make sure your doctor is going to activate the PRP. 99% of them do. The only time they really don't is when you're doing it to your hair. And there's a different reason for that, because it's more of a keratin-based issue, I think. I didn't really look into it much, so don't take my word. Now finally, onto the actual procedure itself. Your doctor is going to give you some kind of local anesthetic. This might be a full-on nerve block, or this just might be a numbing agent injected into your shaft or under the skin. And then some doctors might just use a cream. I don't recommend that because you're going to feel it either way, but you want this to be as painless as possible, because afterwards you got to do something to your penis that does not sound comfortable. There are 6 injection sites, sometimes 4 depending on your starting size. Just up the shaft, 3 sides, and then 3 sides this side. Then there's going to be 1 injection site, maybe 2, into the corpus spongiosum. That's your glands and the tube-like structure that runs down the side or bottom, depending on your perspective. This has much less volume, so it's going to take much less PRP to see a benefit compared to the corpus cavernosum, which holds 90% of the erection, compared to the corpus spongiosum, which is about 10%. So you're probably going to get between 5 to 7 shots that you won't feel, but again, it's trippy to watch. And this part takes about 5 to 10 minutes. There's a good chance you will bleed afterwards, just because clotting might take a minute, because when's the last time you stabbed your penis? There's a good chance for bruising as well. That is more dependent on injection volume. So the more you inject, the more internal pressure there is, meaning there's going to be more pressure pushing blood out of these little pinholes. So that's how you get these bruises usually. It's not that big of a deal, they're just unsightly. Immediately after, your doctor is going to have you pump your penis with a penis pump for about 15 minutes. The methodology or the reasoning behind this is to try to keep all those growth factors into the penis instead of being flushed away. So we're using negative pressure to bring in an erection, to clamp off all the outs of the penis and have them bind to the cells of your shaft and glands. You're not going to feel it unless the nerve agent starts to wear off, and then you might feel a slight pain, but it's not deafening. All right, it's probably going to be like a 2 or 3 out of 10. You can handle it. And then finally, the doctor is going to prescribe you 2 10-minute pumping sessions a day for the next 3 to 4 months. This is so that this tissue is continuously worked in pulling in more of these platelets to bind, to release, and create more penile tissue. Now, if you followed me beforehand, let's just say I have way more advanced protocols for penis enlargement than this. So if you follow those, I can almost guarantee you'll get a better bang for your buck than 20 minutes a day. Unless you're completely new to PE and the idea of penis enlargement, then 20 minutes a day is probably a very good starting point. Side effects I already touched on a little bit include bruising around the injection site, and then swelling under the skin, depending on your own reaction to the injection and your own reaction to the local anesthetic. And this will dissipate over a week or 2, no big deal. And it's nothing really major except for unsightly. And as with any injection, there is a chance of infection. But if you do this at a reputable clinic, that chance is minimal and you keep yourself clean, I can almost guarantee you won't have anything to worry about. So the time frame for PRP, most clinics will say the first 6 weeks is nothing but internal inflammation and swelling. And the 6 weeks after that, that swelling somewhat turns into real tissue. So we're talking a 12-week time period where your penis kind of like just bloats, gets real puffy and thick. And then that thickness and swelling is going to smooth out into new penile tissue. You can get another shot as little as 8 weeks afterwards, but you might want to wait a little longer just to see how your results actually shape up. Time will tell. On to anecdotal results. Most clinics will say you can gain 10 to 20% in total volume per injection. Now, that does sound a little far-fetched, but we're talking maybe 1/4 of an inch to 1/2 an inch in length in 12 weeks. So it's not out of this world. And then same thing for girth, 1/4 of an inch to 1/2 an inch in girth. If you get 1/2 an inch in girth, that's insane. But anyway, I'm pretty sure you'll be very happy with the results afterwards and probably be incentivized to go back for more. Now, I've touched on the girth gains. You're more likely to get better girth gains from this just because, in my opinion, the protocol right afterward is specifically designed for girth. So if you do specific traction therapy afterwards, you'll probably get much better length gains than typical. So keep that in mind. Now, I have 2 clients that I took on for coaching, and then I had another client who gained a lot of girth in short order, but he also took TRT right at the beginning, and he is a bit of a risk-tolerant dude like myself, so he's on other stuff that might be helping his gains. But he is very pleased with the results so far, and he's already scheduled another appointment. And most importantly, his wife noticed the changes within 3 weeks. So if you're just trying to impress your partner, this is going to help in short order. I personally had this procedure done last week, and it's too early to tell my own results, mainly because I had an allergic reaction to the anesthetic. So I have a nice little bubble on under the skin of my penis, it's slowly dissipating. But from what I can tell outside the reaction area, the results have been low-key insane, if I'm being honest. About a quarter of an inch to half an inch, depending on my AQ that day. I'm already quite large to begin with, so again, it's volume and percentage based more than anything else. And I've seen anecdotal evidence where some dude did 6 shots or 6 sessions, and he gained an inch and a half in length and an inch and a half in girth. So I don't want to say believe it as true, but the math makes sense, and it's just something to keep in mind if you really want to go through with this. Now, typically the cost is about $1,000 per session. So if you do 2 or 3 sessions, we are talking $3,000 and about, and we'll just say half an inch in length and then a half an inch to an inch in girth, if you do the typical protocols given to you by your doctor. But who knows, if you do like normal PE, what I teach, you could gain a lot more, a lot faster. Since I've only seen guys do this recently, we'll find out. Now, and something very important to note is that this is not needed for penis enlargement when it comes to my methods. However, it is a huge benefit if you have the cash to blow. And this is honestly a very good option for just general penile health with minimal complications. So yeah, PRP really piqued my interest just because it literally lines up with my theory on penis enlargement. I hope it piqued your interest too. I hope you learned something. I'm sure I did in the past month obsessing over it. Again, if you like what I do, subscribe. If you like this video in particular, like it. I have a Patreon, and I sell men's health aid products at Peak Male Physique. I'm not promising the world with them, but they sure can help. This is BD signing off.